Hello everyone, this is Casey with Occupational Therapy here at Edgewater Rehab. We're going to give a quick presentation about pelvic health and urinary incontinence, or UI for short. We're going to discuss some facts and fictions and how common this actually is. This cartoon just reads, "With age comes skills," is called multitasking. I can laugh, cough, sneeze, and pee all at the same time. Is this you? Does this limit your social activities? Missing or avoiding important appointments? Avoiding travel or visiting family and friends? Getting up multiple times at night and not getting good sleep? Afraid or embarrassed to talk about your incontinence with your doctor? Feeling there is nothing you can do to address the continence concerns? Changing your drinking and eating habits due to fear of needing to go to the bathroom at an impromptu time. And today we're going to learn about how therapy can help you. This is one of the most unreported conditions, along with cognition, that individuals are willing to share and seek treatment for. There is help, and many times continence issues can be improved or resolved. The objective of today's lecture is to have a basic understanding of the anatomy and physiology of the urinary system, understand a basic overview of normal bladder function, appreciate the impact of urinary incontinence, or UI for short, on quality of life, understand general causes of urinary incontinence, learn about the different types of UI and elements of good bladder control, appreciate the role of bladder irritants on urinary urgency and frequency, explore options for intervention and seeking assistance to address continence concerns. So this slide is just reviewing the anatomy of the urinary system. As you see up top, the kidneys produce urine, which is transported through the uterus to the bladder. The bladder is a muscular sac that functions to store urine and then pass urine from the bladder through the urethra and out of the body. The urethra contracts to keep urine in and relaxes to let urine flow out. It is much shorter in women than in men. The internal sphincter connects the bladder to the urethra, and it is like a door that closes and opens to allow the bladder to fill or empty. The urethra contracts to keep the urine and relaxes to let the urine flow out, as we said before. We review the internal sphincter. The external sphincter is the bottom of the urethra and stays closed until it is time to void. So this is just, like I said, a brief overview of the anatomy and the muscles that have to go into the urinary system. So this is a physiology portion. This diagram shows the process by which the bladder is filling and emptying. At the top of the diagram, we have a normal bladder filling. The bladder fills from the bottom up. To prevent urine loss as the bladder fills, the sphincters stay tightly closed and the pelvic floor muscles stay contracted. Moving along the diagram to the right, we note the first sensation to void. This does not necessarily indicate it's time to go to the bathroom, but the sensors in the bladder are aware that urine is filling the bladder. On average, we can wait 30 minutes or so after the first urge before going to the bathroom when the bladder is mostly full. When the bladder is full, a message is sent to the brain to indicate it is time to void. Bladder emptying. When the bladder has filled to a specific volume, nerves will sense that the bladder is full and want you to void. Bladder emptying is accomplished by the following: relaxation of the pelvic floor muscles, relaxation of the urethral sphincters, bladder contraction, which forces urine out of the bladder, and subsequently out of the urethra as well. So these are images of the pelvic floor muscles for both a female and male. These images are a cross-sectional view of the female and male pelvic regions. The pelvic floor muscles are at the base of your pelvic floor and form a hammock of support for the organs in the pelvis. Both men and women have pelvic floor muscles. When they are relaxed, you are able to urinate. When they are engaged or contracted, they stop the flow. These muscles are critical to keeping the lower urethral sphincters closed until it is time to void. If pelvic floor muscles are weak, you may experience incontinence. The anatomy for men and women is relatively similar for both men and women when it comes to issues related to incontinence. So you can see here in both of the images above, you can see the urinary bladder, the urethra, and both of the tracts. And at the bottom of the urethra, there's going to be the sphincters. So this is just an up-close image of what the pelvic muscles are looking like from the bottom up. They are a small group of muscles but play such an important role in bowel and bladder control. They support your organs and your posture and intimacy. There are 3 layers and must respond to changes in intra-abdominal pressure, movement, and bladder and bowel fullness. Continence takes teamwork. Good bladder control is about teamwork and coordination among the following: the bladder, which holds urine or contracts to let the urine out. Muscles and sphincters must coordinate to open and close the urethra, and nerves send the messages to and from the brain, telling the bladder muscles to contract and then the sphincter and muscles to open if need to urinate. If we need to hold urine, our nerves tell the bladder muscles to not squeeze, but the sphincter and pelvic muscles stay toned and prevent urine from flowing. Any one of these areas that have a problem can contribute or cause incontinence. So what is normal bladder function? Average bladder function in the adult capacity is approximately 1 pint. For the older population, it's about 1 1/3 cups. The average number of voids per day, or using the restroom per day, is about 4 to 8 times in 24 hours. And for the older population, it's 5 to 10 in 24 hours. Average at night, under the age of 65, is seldom or at 1 time at most. Older than 65 is 1 to 2 times. Urgency should be rare. A healthy adult should be able to hold the urge to go to the bathroom for up to 30 minutes. Urgency can be the result of bad habits over the years, like holding urine for too long before emptying the bladder. Over time, we suspect the signal to the brain and the overstretching of the bladder from disregard for the need to go changes the ability to hold urine, and also urgency signals are sent too late. So here are some facts about bladder control. Approximately 13 million people, or 1 in 3 adults in the US, suffer from urinary incontinence. Annual cost is more than $26 billion. Most people do not seek help due to embarrassment or unawareness of treatment options. Outcomes from treatment are better when symptoms are lighter or less severe. And we also want to add that numbers are most likely higher, but many people don't report problems to their medical professionals. These are some possible contributors to urinary incontinence. So women, pregnancy and childbirth, hormonal changes, bladder prolapse, and urethral dysfunction. In men, it could be due to enlarged prostate, or that could be putting pressure on the bladder in prostate surgery. Other contributing factors is pelvic trauma or hysterectomies, recurrent UTIs or urinary tract infections, spinal cord damage or lumbar sacral nerve issues, caffeine or other bladder irritants, medications such as diuretics, sedatives, beta blockers, cold and allergy remedies, and pain relievers, decreased mobility, or ease getting to the toilet. Urinary incontinence is not a normal part of aging. Incontinence can be improved. It is common, but it does not mean that it is normal. Some examples of how aging may contribute to the prevalence of urinary incontinence are decreased activity, orthopedic conditions that affect mobility, like osteoarthritis, decreased strength and endurance. However, something can be done. Common does not mean normal. Although the prevalence of incontinence increases due to other factors associated with aging, it doesn't mean that it's normal. So, stress incontinence. Experiencing incontinence when you're laughing, sneezing, or coughing. Urine loss occurs during physical activity that increases intra-abdominal pressure, and weakened pelvic floor muscles aren't able to control the urine loss. Try coughing right now while your hand is on your stomach. Do you feel the additional pressure caused in the abdomen? The added pressure pushes the bladder down, and if your pelvic floor muscles are weakened, there can be leakage as this occurs. Urge incontinence. What this is, it's urine loss with an urgent need to go to the bathroom, sometimes caused by involuntary bladder contractions. Mixed incontinence is a contribution of both stress and urge incontinence. So some examples is, do you experience a sudden urge to go to the bathroom when you put the key in the front door, hear running water, drink a small amount of fluid, or do you have trouble making it to the bathroom when you have to do so? So again, sometimes this can be caused by involuntary bladder contractions, and this could either be stress-induced or urge incontinence. So, overflow incontinence. This is when the amount of urine produced is more than the bladder can hold, or the bladder never completely empties and a constant dribbling occurs. There's functional incontinence. This is due to urinary leakage due to inability to get to the toilet and or use a toilet because of post-surgery limitations, impaired physical function, environmental barriers. So an example is if you're unable to walk quickly from the bed to the bathroom due to either clutter or obstructive pathways, decreased speed or walking ability, or due to a surgical intervention, this is what we call as functional incontinence. Something else is impacting you from getting there quick enough. Stress, urge, and mixed account for more than 90% of all cases. So this is just a little cute outline of each of the examples we gave earlier. So you have the overflow, the stress-induced, which is like that sneezing or coughing. The urgency, that could either be to overactive contraction of the bladder. And functional, which means that you're just limited by environmental matters, either physically or in your environment. They're inhibiting you from getting to the bathroom quick enough. So these are some other possible bladder irritants. A common issue impacting urgency and frequency is the consumption of bladder irritants. Try this. Keep a log of your food and fluid intake for a few days and notice if any of these items impact you. If so, decrease or eliminate the most common ones that are underlined here. You will receive a handout with these. Again, since we can't be in person, if you would like a handout or a copy of these irritants, you can always contact us in the therapy department and we can print this slide out for you. So I'm just going to go ahead and read through them. So other irritants that cause either urinary incontinence or urgency can be alcoholic beverages, fruits and juices, carbonated drinks, highly spicy foods, chocolate because it contains caffeine, anything that really contains caffeine can be an irritant. Coffee and tea and tomatoes. So those are the really highlighted ones that are the most common, but there are a couple other ones on this list. So the most common irritants and strategies to manage. So coffee is a very common irritant. Another way that you can go around this is, if you love the taste of coffee, would be to either do decaf or low acid instant coffee, like a kava. Acidic fruits are also very common, and some other fruits that you can try instead would be pears, apricots, papaya, watermelon, and blueberries. Tea typically also does have caffeine, so instead you can try a decaf tea or herbal teas. Soda and alcohol also do cause irritation to the urinary tract, so try instead would be water. If you drink caffeinated drinks, alcohol, or soda, follow with a full glass of water to dilute the effects on your bladder. Just a little quick tip. So, have you ever reduced the amount of fluid you drink, especially water, because of concerns about having to use the bathroom? So this is a very, very common thing that we hear from different residents that we've worked with. And we're going to go over why this isn't great, because it's very important to still consume water. But a lot of people stop consuming water because they feel like that they're going to have to use the restroom more frequently. So water is the best beverage to drink. Drinking adequate water daily also helps with decreasing issues of constipation, which can cause increased pressure on the pelvic floor from bearing down during toileting activities. Many people with bladder problems reduce the amount of liquid that they consume, hoping to urinate less often. However, reducing your liquid intake causes concentrated urine. This can be more irritating to the bladder lining, which increases symptoms. So it is recommended to have 6 to 8 glasses a day. So just because you're experiencing some urinary incontinence does not mean you should decrease the amount of water you're drinking a day. We really need to look at why the urinary incontinence is happening to you, so that we don't disregard the importance of water on your daily diet. So what can you do? If you deal with urinary incontinence, the next few slides offer some actions you can take. Here are some initial considerations. Monitor your urinary patterns. Keep a log of how many times you void, how long you void, how many accidents you may have a day. And when you see a therapist, you can share this with them, and they can help you with different strategies to address these concerns. Here are just a couple of strategies in bullet point form above. So we have here is the monitor urinary patterns. Schedule going to the bathroom every 2 hours, whether you feel like you need to or not. Drink enough water, like we discussed earlier. Learn breathing and relaxation techniques, as these can help you void more fully. Check with your rehab and fitness staff about Tai Chi and yoga. And stay active, so you can ask your therapist about exercise prescription. The more you exercise and are active, the better your sleep patterns will be. And different kind of breathing and relaxation techniques we talk about is diaphragmatic breathing, and that's something that therapy can teach you how to do. Drink plenty of water unless directed by your physician based on any special medical concerns. Any condition the physician recommends liquid constraints, you would need to consult with your physician and alert your therapist. Practice good lifestyle habits. So some notes to why this helps with UI. Sleep is a decrease, because if you have a decreased amount of sleep, you can irritate the bladder and lead to earlier sensations or needing to void. Deep sleep allows the bladder to rest, so you don't feel like you're having to go as frequently. Watch what you eat and drink, so that kind of partakes back to that irritant list that we had spoken about. Physical activity, General strengthening encourages regular bowel movement and overall bladder wellness. Recreational activity and social activity keeps you engaged, motivated to stay dry, and seek help with improvement of incontinence strategies. So there are different exercises that are specific for people who are suffering from urinary incontinence. Like we had discussed earlier, the pelvic floor is full of muscles. So just like you go to exercise class and you go to therapy to exercise and strengthen your muscles in your legs and your arms, sometimes your pelvic floor muscles also need to be strengthened in order to work correctly. So what else can you do? You can make an appointment with your urologist, your gynecologist, your nurse practitioner or primary care physician to discuss your concerns. What they will do is that they'll evaluate you with the appropriate testing needed. Ask your primary care provider for a prescription for physical or occupational therapy. Here at ACTS, we have therapists who specialize in pelvic health treatment. Not all types of UI are treated the same way, so it's very encouraged to ask questions. So how would the therapy evaluation work for UI? A comprehensive evaluation of your symptoms and needs, treatment to help strengthen and regain control of muscles. This may include stretching, strengthening exercises, biofeedback, and/or electrical stimulation and lifestyle changes, personalized home exercise prescriptions. We can also help with bladder training and urge inhibition training for increased frequency in overactive bladders. Activities of daily living training to assist with environmental modifications, clothing modifications, functional activities, and cognitive re-education and compensation. So therapy and resident partnership. So how do we work with you? When compliance by the resident is combined with our skilled rehab program, outcomes are very encouraging. Most insurances cover pelvic rehab. Your therapy department will verify insurance and inform you of coverage. Your privacy and dignity is important to us. All information is kept confidential. Evaluations and treatments are performed in a very private location. So, Pelvic Health Rehab is here to help you learn more about continence, to partner with you in addressing your concerns, to work on strategies to improve continence, to answer questions, to work with you on improving your quality of life, get better sleep, and enjoy and be engaged in things that you love to do throughout your day. So the October Wellness Talk topic that hopefully we will be able to get to at another time is about falls and attention. And Thrive Acts in 2020, November's presentation is Thriving with Good Energy. The November presentation will be our final Thrive presentation of the year, and we are hoping that if we stay on the current path that we are, that we be able to give this presentation in person. We miss seeing you guys and giving these presentations and lectures to you, so we hope that this will be give a green light to go by that time. So thanks for your time today and listening for us. This is a number listed below that is not the therapy number here for Edgewater. So if you would like to reach out to Edgewater, if you go to your white directory book and look up for ACTS Physical Therapy, the number will be there, or you can always call the front desk and ask them to put you in touch with Stephanie Weiss, who's the director of rehab or the physical therapy department, and we'll be able to address any concerns and or questions. So again, we hope that everyone is staying safe and healthy, and we hope to see you soon.